Hello everyone and welcome back to another video. In this video, I'm starting a new series of anatomy lectures where I'll cover the basics of human anatomy and relating it somewhat to traditional Chinese medicine. If you don't know me by now, I'm a doctor of acupuncture. I'm also a licensed massage therapist and I've been teaching yoga and movement for the past 14 plus years. If you are someone who just likes to learn about the human body, about themselves, then this series is for you because, as I like to say, you will be in this body for the rest of your life. So why not learn the most that you can about it? Also, if you are someone who is embarking on a new journey of learning to become a massage therapist, a body worker, or maybe a yoga teacher or movement professional, then these videos are a great tool that you can have and go back to anytime that you need. In this first episode, we are starting with complete basics, and that is anatomical position, as well as the planes of movement and directions of movement. So anytime we are relating certain anatomical terminology as it relates to muscles and bones, because that's what I will be focusing on, I want you to go back in your mind or standing in your body in what we call the anatomical position. So here on this little pamphlet on the wall, this is the anatomical position. So you're standing with your feet parallel, your arms are dangling by your sides, and the palms are facing forward. The front of the body is what we call the ventral side, and we have the back of the body or the posterior side, which is also called the dorsal side. So front or the anterior, back or the posterior aspect. Also anterior is called ventral, or the posterior aspect is called the dorsal. Think of a dorsal fin on a dolphin, right? Now, there are other areas of the body that we relate to the midline. So the midline is this axis of the body. Anything close towards this midline or this axis of the body, we will refer to as medial. Anything farther away from this midline of the body, we will call it lateral. So anterior, posterior, medial, and lateral aspects of the body. Okay, now as we talk about the planes of movement, we will talk about the three main planes of movement. The first one being the sagittal. The sagittal plane divides the body into the left and right halves, and we have specific movements that occur within this sagittal plane. So think of it as you being sandwiched between two panes of windows, and the only way that you can move is front to back. So the only types of movements that are allowed within this sagittal plane, which divides the body into the left and right halves, are flexion and extension. So for instance, majority of flexion in the body happens on the anterior aspect of the body. The exception would be the knee, right? And I'll go over each of the joints and you'll see specific movements of flexion. And the majority of the extension happens in the back of the body. Again, the exception is the knee joint. So flexion of the shoulder is when we reach the arm up towards the sky. Now, if you're a movement professional, you might say extend your arms overhead. Now, the extension there is really only in our elbow joint. However, flexion of the shoulder is when we reach the arm forward and up. Flexion of the elbow as well in the front of the body. Flexion of the wrist in the front of the body. Flexion of the neck in the front. Flexion of the rest of the spine towards the front, such as when you're doing a crunch or a curl. Flexion of the hip. Flexion is happening in the front of the body. And when I said exception is the knee, look at your knee. When you're standing, the extension the knee is extended in the front of the body, right? Now, extension of the rest of the joints happens in the back of the body. So extension of the shoulder would be when you reach your arm to the back. Extension of the elbow, the same. Extension of the wrist, the same, because we're looking at it from the anatomical position. And again, the anatomical position is when your arms are dangling by the sides of your body, palms facing forward. So flexion of the wrist, flexion of the elbow, flexion of the shoulder. Also flexion of the fingers happens in that sagittal plane, right? So remember, you're sandwiched between two panes of windows. You can't move side to side. You can only move front to back. Extension of the back, like a back bend. Extension of the hip when you move the leg to the back. Now, again, the exception is the knee, because when you bend your knee behind you, that is called knee flexion. Okay, so that was our sagittal plane and these directions of movement. Now we're moving on to the frontal plane, also known as the coronal plane. The frontal plane divides the body into the front and back, anterior and posterior, or ventral and dorsal aspects. And the only type of movement that happens within this plane, frontal or coronal plane, are abduction. So that means moving away from the midline. I like to say, abduct me away. And adduction, bringing the limb back to the midline of the body. Okay, so in frontal plane, we have abduction and adduction. We also have lateral flexion and extension. We can do abduction of the hip, moving the leg out to the side, away from the midline, or bringing the leg back to the midline, adding to the midline. So abducting away and adding it back to the midline. Abduction and adduction. And lateral flexion, so lateral is the side of the body, right, away from the midline, and extension, lateral extension. And then we have the transverse plane, and the transverse plane divides the body into the top and bottom halves. And the type of movement that happens within this plane is horizontal abduction and horizontal adduction. So think about looking at the horizon, and horizontally abducting the arm away, horizontally adding back to the midline. And the same thing can happen with the leg, horizontally abducting and horizontally adducting. Okay? So to recap, we have the sagittal plane, which divides the body into the left and right halves. And the movement there would be flexion and extension. We have our frontal or coronal, which divides the body into the front and the back, or anterior and posterior aspects. And the movement is horizontal, the movement is abduction and adduction, and lateral flexion and extension. And we have the transverse plane, which divides the body into the top and bottom halves. And the movement is horizontal abduction and horizontal adduction. Okay, and remember, anytime we're referring to this type of movement, we're going back to our anatomical position where the feet are parallel, arms are dangling by the sides, and the palms are facing forward. All right, now connecting this to traditional Chinese medicine. In traditional Chinese medicine, I'm sure some of you have already heard about this, we have what are called meridians, or channels. And we have 12 primary meridians or channels that run all throughout our body. Now, most of the yin channels, we have yin and yang channels, right? Yin is the feminine principle and yang is the masculine principle. Most of the yin channels run on the anterior aspect of the body. The exception is the stomach channel, which is more anterolateral, so anteriorly and slightly lateral. Most of the yang channels run on the back or the sides of the body. So on the anterior aspect of the body, when we look at the arms, we have the lung channel, we have the pericardium channel, we have the heart channel. These are our yin channels and they run on that anterior aspect. On the lower limbs, we have also yin channels that are running from the toes up into the torso. So we have our spleen channel that runs from the big toe and goes up, up, up the anterior aspect of the body and actually ends at the rib cage. We have our liver channel that also starts at the big toe, but it is running a little bit more laterally, right, on the big toe, also going up the anterior aspect and ending at the ribs, right underneath the breast. We have our kidney channel. The kidney channel runs from the bottom of the foot, and runs on the inner aspect of the leg, just like the spleen and the liver channel, and it ends all the way underneath the clavicle. And then we have our yang channels. We have the stomach channel, which I said runs anterolaterally on that front of the body or the anterior aspect of the body, and it starts underneath the eyes, runs all the way down the anterolateral aspect of the body and ends at the second toe. We have our gallbladder channel. The gallbladder channel runs on the lateral aspect of the body. It starts on the head actually, and it runs on the lateral aspect of the body, ending at our fourth toe. We have our small intestine channel. The small intestine channel runs on the side of the arm, all the way into the face. And we have a channel that is really an interesting channel. It's called the triple warmer, the triple heater, or the San Jiao in Chinese. And that channel runs also on the posterior aspect. Now, if we look at the anatomical position, the posterior aspect would be the back of the arm. So this channel runs from the fourth finger all the way up the posterior aspect of the arm, and it ends in the head as well. So really, really interesting, right? Looking at the meridian channels and looking at what is anterior, what is posterior in the Western anatomical concepts. So I will end here for today, not to overwhelm you with more information. And if you like this type of content, please like and subscribe. It really helps the channel grow and spread this free knowledge to more people on this planet. I am so passionate about teaching. I love it. And I would like more people to know about these concepts. So like and subscribe and stay tuned for the next video. Thanks so much for watching.